Greetings, I am presenting a new innovation OmniFlow, a novel, small and effective drainage device for complicated open-angle glaucoma. OmniFlow is a sutureless, sure shot shunt and the best glaucoma drainage device to drain aqueous from the anterior chamber to the retrobulbar space by preventing hypotony and keep IOP between 10 and teens 24/7 with least use of anti-glaucoma medications. Retrobulbar space behind the equator is almost free from myofibroblasts, therefore it is virtually free from fibrosis even without mitomycin C and can drain up to 500 microliter per minute of aqueous. This is how this 50 mm length with 0.3 into 0.7 mm drainage device looks. After putting a L-shaped cut in the conjunctiva and after little blunt dissection, insert a vectis to reach retrobulbar space, which is too easy. Up to 40 mm of wire vectis can be inserted with ease and creates a track. Minimum and gentle bipolar cautery is done. After this, at 45 degrees and 5 to 7 mm away from the limbus, a scleral tunnel is made with 23 gauge angled MVR blade. This tunnel is properly lubricated with 2% HPMC. The beveled end of OmniFlow is now inserted and passed through the scleral tunnel. 3/4 length of the OmniFlow tube is pulled out and the walled distal end of the tube is inserted into the retrobulbar space, which goes into the retrobulbar space quite smoothly and easily without any resistance. The excess length of the tube is pulled back and pushed back into the retrobulbar space. Now a second scleral tunnel is made, which is radial or perpendicular to the limbus up to 2 to 2.5 mm from behind the limbus, which is then gently entered into the anterior chamber, bisecting the angle of anterior chamber and the iris. Now the beveled end of the OmniFlow tube is inserted into the anterior chamber via the second scleral tunnel. Care must be taken that only the beveled 1.5 to 2 mm end goes inside. Then the excess bend of the tube is pulled back and slowly pushed back into the retrobulbar space. This is a case of double OmniFlow. IOP was around 100 mm of Hg in a one-eyed patient who had undergone multiple RD surgeries with repeated silicone oil injections with multiple failed trabeculectomy. After surgery, IOP came down to 19. These were the results in the clinical study with success rate of over 90% in 23 patients. IOP came down from 30 to 70 mm of Hg to 10 to 15 mm of Hg immediately after the surgery. 18 patients maintained this level of IOP without any medications till a year. 4 patients required dorzolamide plus timolol combination eye drops and 1 patient required 1 more tube implantation. There was no loss of vision and lines in any patient. So, in conclusion, OmniFlow will revolutionize the management of all types of primary or secondary and intractable open-angle glaucoma, neovascular rubeotic glaucoma, silicone oil-induced angle recession, posterior embryotoxin, and glaucoma in Sturge-Weber syndrome in a most cost-effective manner. I will be forever indebted to all these great and wonderful persons in my life. Thank you.